Good morning, my name is Joanne, and I'm going to be doing the pediatric infant vital signs. I'm going to gather all of my equipment, and I have my baby here. Okay, so first thing I'm going to do, now that I have gathered all of my equipment, I'm gonna go ahead and wash. I'm gonna go make sure baby's safe. I'm gonna wash my hands. Soap and water. I'm gonna go ahead and apply my gloves. Okay, so I am going to go ahead and note what the baby is doing. So my baby is calm. She's sleeping right now. So I'm going to count my respirations while she's sleeping. I'm not going to wake her by placing one hand on the abdomen, or I can visualize the chest rise and fall. So I'm going to count, and then a normal respiration for my baby should be between 20 to 60. So now that I've done that without waking the baby, I'm gonna go ahead and verify with the mom. I'm gonna ask mom, do you can you please verify baby's name and date of birth? And I'm going to check the wristband to make sure she's saying the correct thing, and she did. So then now I'm gonna go ahead and assess the baby for pain. I don't see any signs of pain for the baby. If I was to if there was an older child, then I would be able to use the flat scale to go ahead and rate the pain. Okay, so I'm gonna ask mom also, do you know if baby has any allergies? Any known allergies? So at this moment she states no. So now it's my time to go ahead and try to bond with the baby, to build trust with the baby before I do any other thing. And I'm gonna give the baby praise. Good job, I'm so proud of you. You're doing an excellent job by helping me today, and I really appreciate it. I'll be sure to have some stickers available for you after, okay? Alright, so now I'm going to go ahead and count my apical pulse for 1 full minute by auscultating between the 4th and 5th intercostal space. Okay, so the normal heart rate that I should get for the baby is between 80 to 170. So the baby's heart rate is within normal range. So I would take the blood pressure and make sure that I have the proper cuff size. However, since this is an infant, I will have to verify and get a doctor's order before I can go ahead and take an infant's blood pressure, and even then I will still make sure to have the proper cuff size. Okay, I'm just gonna readjust my thing. Alright, okay, and sorry about that. And with measuring the proper cuff size, you have to make sure that the width of the cuff is between 40 to 50% of the infant's or the child's arm length. Okay, and it's from the ocelarium to the acromion. So now, and make sure that the bladder cuff covers between 80% to 100 of the child's arm circumference. Okay, and then the normal blood pressure for the infant should be between 46 to 92 systolic and 38 to 71 diastolic. All right, so right now I'm going to go ahead and take the temperature via axillary temperature by placing the probe into the axillary space and bring the child's arm close to the body. So I'm gonna go, I'll be doing this. Sorry, I don't know if you can see. Okay, this is my thermometer. Sorry. So I'm gonna bring the child's arm closer, perpendicular, and bring the child's arm in. So the normal temperature for my baby is between 36.4 to 37.2 degrees Celsius, or 97.5 to 99 degrees Fahrenheit. Okay, so my baby has normal temperature. There's no needed intervention at this time. So I'm gonna go ahead and apply a cover to the scale. I already did that. So, and I'm going to take the clothes off my baby, weigh the baby without the diaper so that I can get an accurate measurement. So I've covered it, and I'm going to place the baby on the scale in the middle. Okay, so let me press the button. Alright, so I've already weighed the baby, and I was right here, so I didn't have to worry about my baby falling or anything. So now I'm gonna go ahead and measure my baby's head circumference. This is my tape measure. I'm making sure to start by the line and fold. I'm going to measure my child in recumbent position for newborn to 2-year-olds. Okay. Oh, sorry. So I'm going to put a mark at the top and straighten the feet and put a mark at the bottom of the feet. From the top of the head to the bottom of the heel. So I'll be sure to fold the top. Okay. Alright, so I've measured my baby. Alright, so now I'm going to go ahead and measure the baby's head circumference. Which for an infant is usually 32 to 36. And for the chest circumference is usually 1 or 2 centimeters lower. So I'm going to go ahead and measure that. Alright, you're doing a good job, baby. Thank you so much. We're almost done. Okay? And I got the chest circumference. So I'm going to go ahead and document right now. I'm going to document my height and weight. And on my assessment data. I'm going to make sure to have my baby secure. Mom is here with the baby. So at this time, I'm going to go ahead and end the procedure. Make sure to put it into the growth chart. And that's it. Thank you.